I'm doing a live, and if you can hear me or if you can see me, just make sure that you click or watch this video. This will be the most important video for you, for anybody with a mouth, for us all with health. I mean, this really should terrify you if you don't know this information, and I'm not doing that to alarm you, but just to impress upon you the importance of the information that I'm about to share for your health, because nobody quite organizes it in this way. There's a few doctors that are starting to talk about it, but this is all I've thought about for the last 4 years, almost 5 years actually, since I lost my dad. And that's why I'm even doing this in the first place, is I lost him far too early. And they said that he had undiagnosed heart disease. And that's the reason why he was on a hike and he just died, right? But turns out it was actually uncontrollable infection. It was sepsis, and it wasn't just magically appearing in his heart. It normally, or it rarely ever does, start in the heart or breast cancer. We're finding out in 70% of the cases, heart disease, breast cancer, it actually starts from an infection in the mouth. And we know this because, we used to take chest x-rays and we take mouth x-rays, but as you scan out or zoom out and you see the whole picture, you start to see, or you're like, hey, what is that thing in the image? What is that, from the mouth? And it seems like it's kind of going around the body, but then it's pulling around again in the chest. It's nothing super complex. Let's just take all of our science and all of our doctor hats off for a moment. If you're a doctor watching this video, by the way, kudos to you. This is the more of the patient video, by the way. We have dentalismedical is for the dentist, and I just made a video for dentists that they should fully get paid. But this one's for the patients, because I really want to help everyone out there, and for your loved ones even, to get in a healthier spot. And I was told, like my dad was told, to go to a doctor, right? But it turns out that in most cases, you want to skip the doctor and actually visit a dentist, because that's where all of the problems begin. I mean, unless if you like wasting money, you like being in pain, and you like being sick, you can ignore this whole video and just go on with your day. But if you're too busy right now, definitely make sure you save this video, bookmark it, or come back to it. And this is on a lot of different channels. I'm going wide with this because I've prepared this information specifically for you. So I hope that you can save this information. And if I could get this done in one take, hopefully I can. I'm just going to do this presentation just once. And hopefully I could just point to it. So the point is that literally, I'm about to share with you the most important thing for taking care of your body. And just like you can't pay somebody to do your push-ups, I'm going to say you can't pay a doctor in definitely 9 out of 10 times to get yourself healthier. It's something that you have to choose. And if you're going to a doctor, you're probably in the wrong place to begin with. So first thing that I want to start with is health starts from mouth, right? And I actually read in a book, it's called The Hidden Epidemic by a Dr. Thomas Levy, a very smart doc. He actually was a cardiologist, so he was a heart doctor, and he left being a heart doctor because of the information that I'm going to point to, and then the other information here that we're leading out to. But what he found out is that 70% of all heart disease and breast cancer, it all starts from the mouth, right? And he found out that dental isn't a luxury. It isn't optional. It is a must. And I think that we all know or will agree that the mouth is the most important part of our body and our health. So this is important. It doesn't matter whether, for political reasons or financial reasons, they deleted the most important part of the body, or they try to use, that 6-letter word that begins with D and ends with L. I think that we, all know. Where is it? It's not a good enough reason or excuse, right, to not cover the most important part of our body. So we're taught to ignore that. And I'm going to say, and this may sound like a very crazy statement at first, But some things may sound crazy at first, but after you sit with it a while, those crazy things can maybe feel not only not crazy, but like you should have known it the whole time. So what I mean is, right now we go to a doctor and because it's not covered under health insurance actively, or because we don't know it actually is. Your mouth is covered under the health plan, and that's what we're going to get to in this presentation. But health is not some mysterious thing. My dad, they were saying that he had diabetes, a high blood pressure, and cholesterol, and he was taking medications for all of them. But it turns out that it wasn't those three things that he was taking medication for. Those were only the symptoms. If he had gotten rid of, the root canal that was infected, or the infection in his jaw, specifically, that he may not have had those other issues or needed to take any of the medication at all. And that's what we're finding out. It's not just for these two things that we talked about here. It's not just in the chest. It even affects, mental illness issues, infection, and other disease in other areas of the body. It's just that it mostly ends up in the chest because, everything just goes through the chest. And it's amazing how simple it is, right? Because the mouth is part of the body, that dental is medical, and we shouldn't allow a insurance or a doctor's office or anybody specifically, even if it's a front office manager at a dental practice, to say no to our health and our medical needs, the most important part of our body. So if you have a Medicare card, Medicaid, Medi-Cal, what we call it here, or any of the state, federal run programs, or maybe you have a private plan, doesn't matter. Your health plan covers you from head to toe. And last time I checked, my mouth is part of my body. And so unless if something has changed for you, I just kind of say that jokingly because we pretend like it doesn't exist. But forget the dental for one moment. Make sure that you use your health card for any of the health treatment that you're getting in your mouth. And 9 out of 10 times, it does qualify. So I would say make sure you present your health card first. If they don't know how to take your Medicare or your medical plans, this is what this presentation is about. I'm going to show you exactly, where to go, and we have more information and videos sharing exactly what to do, because you shouldn't have to pay out of pocket for something that you already paid for, and you shouldn't have to overpay or pay twice for something that you are already promised. So we all know that the mouth is part of the body, and this word should never be a good enough reason or excuse. So you may know that, but we never really talk about it. So the right thing to do is demand that your dental be covered under your health plan, or your dental, be done for medical or health reasons. And that's literally the only difference between your dental being covered or paid for you, or you having to pay out of pocket, is you just stating that or demanding it and just knowing that it's possible, right? So before I lost my dad, and if I knew what I knew now, I really wish I could go back. I would actually tell myself to make sure that, you go visit the dentist, and the dentist first, not a doctor, because the doctor can do very little. They're mostly dealing with medication and symptoms and surgery. And if they can't deal with the mouth, where 70% is proven, but actually 90% of all disease we're finding out comes from the mouth, then it doesn't matter what you do. It doesn't matter how much good water you drink. It doesn't matter how much good food you have. It doesn't matter, how clean of a diet you even have. If you have an infection in the mouth and you're leaving it alone, you're not going to be in a good spot, right? And that's what this is about. So what I will say is the health of your mouth is the health of your body, and it is the leading indicator or predictor of your health. So that's what we're finding out. And I just realized that I didn't prepare the rest of the slides. So I'm going to go ahead and stop this live, and I'm going to come back and do the second portion of the live where we share exactly how you can get the help that you need as a patient to understand, not just your mouth better, but what to do about it. And so how you can take charge. Oh, and just before we break off, take charge, take charge of your mouth, because 9 out of 10 people, they feel better and they take less medication after proper dental care. And whether you know this or not, I do want to make it more commonly known because I really truly think that most people out there, they may know it but don't think about it. So I'll leave you on this video with that. You do want to take charge, and I'll see you on